Good afternoon, Kahnawake. We see that many of you have been waiting patiently for us to come on the air to provide you with an update today. So we'll be doing just that. We're going to give you as much information as we can, and we'll repeatedly be giving information every day or every couple of days so that you can have the best information to make safe decisions for you and your family. So just a quick note of what's happening around us. We know that there were 4,571 new cases today in Quebec. What we're seeing is that cases are doubling almost every 2 days. So we are expecting by Christmas, as we had mentioned, a lot of new cases per day. The positivity rate is presently at 10%, which means that the total amount of people being tested, 10% of those being tested are receiving a positive result. We think that number of positives are actually much, much higher because, as many of you may have experienced, it's really difficult to get a PCR test these days. The testing sites are full, the labs are full, and we wanted to talk to you a little bit about that today and what's happening to counteract some of that difficulty in getting access to testing. In the Montérégie area, there were 761 new cases. Omicron is now accounting for 30 to 40% of all new cases. So that's quite a significant hike, considering that just last week we were at 10% of all new cases. So we see that Omicron is rapidly increasing and taking over and slowly will, well, I shouldn't say slowly, quickly will become the dominant variant. Some changes. So let's talk about the rapid tests, because this is one of the measures that is being implemented here in Kahnawake and across Quebec in order to counteract some of this accessibility issues to PCR tests. PCR tests, all the labs are, the testing sites are quite full, including the KMHC site. Although we were open today, we're open on Wednesday, and we have been able to accommodate. We tested approximately 46 people today. What we're seeing happening, and I'm just giving you the information so you know if you do go to a testing site outside of Kahnawake, for people with symptoms, and at some sites for people without symptoms who are contacts of a positive case, they are being given rapid tests and sent home because they cannot accommodate the amount of people who require testing. So it's possible that you could receive a box of rapid tests and that you be sent home to perform your test at home. What people are being told is if they're negative, even though the tests are not 100% reliable, to stay home until your symptoms have resolved. If they do not resolve, then try to do a PCR test. If you're positive, some sites are asking you to come back to validate your PCR positive result. Others are asking you to simply isolate right away. So depending on where you go, you may get different information. For the time being in Kahnawake, we are open and we are doing the PCR tests. We are not sending you home with a box of rapid tests, although we may get to that point as well. Our testing site in Kahnawake is going to have limited availability over the holidays. We're open, we were open today, we'll be open on Wednesday, and then the following 2 Wednesdays. However, we will just be open that 1 day a week. We are allowing our staff to take a bit of a break over the holidays. You might be thinking it's crazy, it's not the time for a break, and you're absolutely right. However, people need to have a break. We have been, the staff have been working nonstop since March 2020, and we have to give them a break in order to sustain the availability of these resources after the holidays. So the testing site will only be open Wednesdays for the next 3 weeks. So this Wednesday, the coming Wednesday, and the following Wednesday. That will come out in a communique shortly, probably tomorrow morning. So rapid tests. We do have rapid tests available for every single community member. It's a box of 5 tests. We released a communique on Friday that gives you access to a link that shows you a video on how to use the rapid tests, as well as the instructions. The rapid tests are being being handed out at the arena, and we actually delivered almost 4,000 boxes today. So Ajeza and the public safety team took care of organizing that and done a really great job. So thank you for participating. We urge you to use those rapid tests. They're another form of protection, and we do ask that you let public health know if you have a positive result so that we can help you with contact tracing and isolation. However, it's really important that if you get a positive result that you do self-isolate. Vaccinations continue. We will be open tomorrow and Wednesday, and then again, for the same reason as the closure of the testing site, we will not be vaccinating between Christmas and New Year's because our staff really do need to take a bit of a break. And you may have difficulty getting access to boosters outside of the community. Right now, Quebec is providing boosters to people 65 and over. So if you meet that criteria, you could potentially get access to a test elsewhere. Otherwise, as you know, in Kahnawà, we're giving boosters to anybody 18 and over. So the criteria for access to boosters has changed from 6 months to 3 months. So if you have had a second dose, and it's been 3 months since your second dose, you are eligible for a booster. This has changed very recently in Quebec, and so we are respecting that interval between doses as well. We still have both Pfizer and Moderna available. If you are under 29, it is recommended to get Pfizer as a booster no matter what vaccine you had for your first and second dose. Public health. I've talked about this already, but I want to just confirm that changes have already occurred from our local public health team. So I'm going to go over those changes, and there'll be a release first thing tomorrow morning, so you have access to the information in writing. But we are no longer capable, and neither is regional public health. There have been many, many changes, no longer capable of contact tracing. Therefore, here's what you can expect if you are positive. So a person who does a PCR, who has a positive test result, will receive an email from confirming their positive result, and you will receive a phone call from the Kahnawà Public Health team. We will help you kind of go through identify who your contacts may have been, ask you questions that will jog your memory, help you identify where you've been, who your contacts are, and then you will receive an email which will explain to you exactly what steps you need to take as someone who's positive, and then you'll also receive a generic letter that you will provide to the contacts that you've had over the course of your contagious period. And again, we'll help you with that, but this letter will be given to you so that you can provide it to your contacts. So it's very, very different format than what we've seen up until now, and a lot of responsibility is being placed on the individual and on all of us as individuals to be able to manage ourselves, our contacts, our family members, and our safety. And this is going to change a little bit how the process and how the number of cases will multiply more quickly because we are not calling all of the contacts of the positive cases as we did prior. So a lot of responsibility being placed on us as individuals. There are changes being made every day to public health measures. So a couple that we know of as of today, if you're a contact of a positive case, depending on where you live, you may receive different information from different areas. So Kahnawà being part of the Montérégie area, meaning there are less Omicron cases in Montérégie than there are in Montreal. Therefore, isolation measures differ a little bit, again, depending on where you live, based on the epidemiological status of that particular location. So just the easier way for me to explain that is because you live in Kahnawà, if you are a contact of a positive case, you will be asked to be tested and you'll be asked to isolate until you get a negative result. That may change tomorrow, but for now, that's what the situation is. Again, your local public health team will advise you in the letter that you receive about how you should act, whether you should be in isolation or not, whether you're vaccinated or not. So again, this is changing as we go every day. We're in a bit of a situation like we were in March 2020, where directives are changing as we learn more information. So we have to be really patient and understanding about the fact that we're learning as much as you are as we go, and providing you with the most up-to-date information as we have it. I wanted to also mention there are some changes to visitation in the hospitals around us. So, for example, if one of your loved ones is at Anna Laberge, or if you need to go to the emergency room, you are no longer allowed to accompany somebody into the hospital centers. So accompaniments are no longer accepted. However, if you are an individual who's going into the hospital and requires a natural caregiver or assistance, then one person is able to assist you into the hospital setting. If you are providing assistance to someone who's staying in a hospital setting, then you can go to a maximum of 2 different people can go per day, and only 1 person at a time. Again, those rules may change, but that's what we have as of now. There will be some changes to visitation at KMHC and T-Bell also. We are just in the process of implementing those changes, but I'll advise you of them now, but families are being called as well. So visitation is no longer as open as it was before. So still you require proof of vaccination to enter in for visitation, both at T-Bell and KMHC. A maximum of 2 people per day can visit, and only 1 person at a time. So you can never, you cannot at this particular time come in groups of individuals, only 1 person at a time, and only 2 max per day. Visitors are no longer allowed in common spaces. So if you do come in to visit, you would go straight to your loved one's room, and then you would leave the premises directly from your loved one's room. And masks are required at all times. Speaking of masks, another change and something I want to make clear is that at this particular time, cloth masks are no longer acceptable. They are not going to keep you safe. Non-medical grade masks, as we had talked about in the past, 3-ply non-medical grade masks are what's most effective, and even more protective are the KN95 masks that you can find at the pharmacy. So if you are able to get them, then that would be the most protective at this particular point in time. We don't talk very much about aerosolization, but we really want to talk about it today because all recent studies and data are pointing to the fact that Omicron is aerosolized. That means that it can be in the air around you, and this is why the transmission is so much more rapid than we've seen in the past, and why ventilation, airing out your rooms, opening your windows several times a day, avoiding gatherings, staying close to home is really, really important. Again, we are the measures that Lloyd will present to you after I'm done today are really in order to minimize contacts as much as possible. So although we are not moving towards a shutdown at this particular time, we still are urging community members to stay as close to home as possible and to limit your contacts as much as possible. This is really important. Of course, you all have all of the information. Again, I keep saying it because we are still in control of our day-to-day and of our own safety, and it's just about making the appropriate choices so that we can stay safe. If somebody vulnerable lives with you, again, you must go to the more extreme safety measures and just in order to protect each other, and that's really important. The other thing that we want to mention is about kindness. it's not easy to be in this situation. We all thought that we were moving towards a safer place with less measures, and although we knew that there would be other waves to come as we move forward, I don't think any of us expected anything this swift and urgent to take effect, especially right before the holidays, right when we were making plans to, have a somewhat safer ability to gather. So what we really need now is people being kind to each other. There will be a lot of COVID cases. We're expecting that, and it's not the time to shame people on Facebook. Nobody asked to get COVID. Everybody is doing their absolute best. All of us, each individual, whether it be a family or an organization or a service, we all really need to stand together, work together to get through this next phase. We still do not have a lot of information in order to allow us to make the best decisions. We learn new things every single day, and it's important that we allow that flexibility and that openness to these changes as they come, so that we can have an easier time getting through the next few weeks. So again, the goal is to limit your contacts as much as possible so that your family members, your loved ones stay as safe as possible. And I'm going to let Lloyd speak now about some changes to some of our measures that we currently have in place.
Thank you, Lisa. Yeah, certainly I think it's worth repeating a few of Lisa's comments, that the situation is certainly evolving, to say the least, on a day-to-day basis and hour-to-hour basis. And as we were sitting here earlier this afternoon going over some of the information, and we kind of had a flashback to March of 2020, where there was a lot of unknowns and we had to make decisions based upon limited facts and some I guess limited information and limited facts, but also looking at protecting our community in the best possible way moving forward. It's a very difficult situation to be in as we see what's happening across the province of Quebec, and I'm sure you are all well aware now what Quebec has taken some significant steps in closing down and limiting areas of where people gather. We looked at that very closely, and we did have some discussion on that, and I'll touch on that in a minute. We also have some discussions, and as we always said, we look everything through a Kahnawake lens and try our best to find a way, a path through whatever is facing us, and try our best to balance off. Health obviously is always our priority. We also have to understand there's the mental health aspect that we have to deal with as well, physical health and mental health, and then there is obviously social issues, and there's also the economic and political as well, Kahnawake being Kahnawake. So we have to try to balance all this out as best as we can and help guide the community moving forward. We are following the situation closely, looking at what's happening around us, what's the capacity of the healthcare systems outside Kahnawake, and as Lisa mentioned, what's the capacity internally. The staff at KMHC and public health have been working very long hours for a very long time, since March 2020, and so yes, they definitely do need a break. We have to protect them as much moving forward, because we are in this again for the next while, and we need to make sure we have people who could sustain as best as possible the services within our community, and also look at the threat that's generally over facing our community, and looking at the situation, and dealing with it and addressing it in a manner that we feel is appropriate. And not just, as some people will say, we're doing whatever Quebec does or whatever Legault does, and we do. That's certainly not the case. We look at every situation differently, and sometimes, yes, as I said many times here on this show, yes, what Quebec does is we deem to be the right thing to do, and other times as we've seen in the past, we had disagreed, and that will continue to be the case now and moving forward. But we do our best to follow our own path moving forward. One of the major factors that got us to where we are today is, as Lisa touched on a little bit, is the Omicron virus and the way the latest information is coming up, and it is talking a lot about it being aerosolized, it being airborne, and which is something that we haven't really seen throughout the pandemic. That's why, as you mentioned, it is very transmissible. So we have to look at this very seriously. And it is a serious threat to everybody, and we are trying very hard not to revert to a complete closure of businesses. We're trying very hard to avoid a complete lockdown, as it's commonly referred to. So we want to take steps that we feel are going to try to balance as best as we can all the factors I touched on earlier today and move forward. But keeping in mind, the situation is evolving rapidly. Things are changing, and new information may be forthcoming in the hours and days to come. And so whatever measures are being talked about today could change quite rapidly. But we're trying to be as positive as we possibly can. So, as you may know, Quebec has closed their schools. Our schools will be closed. They have a half day tomorrow, and then they will be closed afterwards. And this was previously announced, and they will be closed until the return on the 11th. Teachers return on the 10th. Again, ongoing assessments day by day. Sports in the community, effective immediately. All sports practices and tournaments were already stopped, but all sports activities will cease to operate. So if there's any practices or such or games that were planned for hockey, for example, they are suspended effective immediately. And after some discussion, we looked at the situation of bars, restaurants, and social clubs in Kahnawà, and we have previously reduced the capacity, which will come into effect effectively today for 50% capacity. We are further adding on there the fact that the distancing between tables must be 4 meters, and this will come into effect tomorrow. So they have to rearrange the distance between tables to be at least 4 meters. Again, this is to address the issue of airborne viruses, and it helps to minimize that risk. Obviously, ventilation is key, in which we always been saying. So that is something that we need to consider. So no rentals of halls, no parties, things of that nature are no longer permitted. Again, because of the close proximity to individuals. So we need to also maintain the fact that the vaccination measures are still in effect, and that will remain for the foreseeable future. Areas that have bars, they will have to no sitting at the bar, as we've seen previously in the past. Individuals will have to be sitting at a table, and having their drink or having a meal, to minimize contacts as much as possible. Also, the closures will be at 10 p.m. Again, effective tomorrow. Gaming as well, they have previously reduced to 50% capacity. Again, no parties or no hall rentals permitted. No more food or drinks allowed in the gaming area. And their closure will also be at 1 a.m., from 6 a.m. to 1 a.m. effective tomorrow. No, there's a lot of information here. Again, as we always do, we will be putting this in a press release outlining everything. But we are, again, like I said, trying to minimize the impacts overall and it's not easy trying to balance everything out and moving forward in a way that we think it takes everything into consideration. And believe me, we do have our discussions here, on what's the best way forward, but we do our best to provide the information, to the community. Moving forward, if these measures do not have the desired effect and stuff, and we will have to consider additional measures. I won't stand in front of the community and say anything otherwise. There is a possibility, that we will have to look at the closing of all areas that people gather. We may have to look at other additional measures, if the situation gets even further critical, and if we're dealing with major outbreaks and major community spread in Kahnawà, we'll have to look at additional measures. Again, that's something that we hope we don't go that way, but again, things are evolving very, very quickly, and we'll do our best to keep you up to date on those areas. We also will have additional inspections taking place to ensure the level of compliance within the places that are open, and in terms of the the peacekeepers will be returning back to the way we did it in the past, and they will be doing drop-in visits at various locations. Again, the primary goal there is not necessarily to give somebody a fine or to enforce, but just to verify that things are working properly in accordance with the local measures, as well as our inspectors will also be out and about giving information and assisting any location in implementing the measures that I just outlined. Areas also to mention, because we've been getting questions already, people who are involved in the manufacturing or construction industry. As previously mentioned, people should be wearing masks at all times when indoors. People should be also wear masks if you're in close contact with individuals, even if you're outdoors. Any store, business, cigarette store or market or wherever, as we did in the past, where we minimize the amount of people in the store at one given time. Those are the measures in which we're going to be reverted back to ensure that a minimum of 2 meter distance is maintained. Obviously, masks were appropriate and inside. More information, again, that information will be released once again, but I just want to underscore the fact that it is an alarming situation that we are currently facing. We will continue to update the community, either if need be on a Facebook Live. We will do it on various releases through the community to ensure that people have up-to-date information. So with that, I will turn it back over to Lisa to come on for 1 more minute, and then we'll take it from there. So with that, Onigawai, talk to you soon.
Thanks. I wanted to come back because I was just waiting for an update on the number of active cases, and I wanted to explain a little bit why our measures are a little bit less severe than in the rest of the province. So over the weekend, we had received a total of 6 new active cases. I'm still waiting as we speak for the update on the total active cases, but if none had recovered from Friday, we would be at 29 active cases. Still, what we're seeing currently is that our numbers are not escalating at the same speed as we're seeing in the rest of Quebec. This could be for several different reasons. One could be that we're taking precautions and that people are staying home. But it could also be because of our difficulty in accessing testing, because community is not necessarily getting tested as much as they should be, or that people are using the rapid tests and not necessarily validating those results. So but the fact, so the decisions we make today are based on Kahnawake specifically and the numbers that we're seeing. So over the next couple of days, we're going to probably have a better picture of what's happening in the community. But based on what we see today and now, because those numbers are not escalating as quickly as what we see happening outside of Quebec, this is why we feel that it's important to not go to a complete shutdown of many of our services. However, based on the fact that all the information that we've given you about this virus and about Omicron, and specifically about the fact that it spreads so easily, that it multiplies so easily, that there is evidence of the virus being aerosolized, we do feel that it's very important to stay home. So again, these decisions are yours to make as individuals with the information that we provide you, the best information. And again, we will continue to keep you updated with number of cases as we move forward, and also some stats from the most recent wave, because now we do feel that we're entering into a fifth wave, and so we'll start our stats over from this moment forward. So again, with that, we'll speak again soon, hopefully not until after the holidays. Okay, thanks.